welcome to another episode of Futures Fast Forward. I'm your host, Samuel Anthony Otero, coming to you today with the next episode in our series looking at careers in healthcare in Pennsylvania. You know, nursing is an integral part of the healthcare process. Indeed, for thousands of years, since the beginning of man, the nurse has been an integral part of our society. I mean, everything living at one point or another is going to fall ill and have some downtime and might need a little bit of help and nurturing. And I mean, for instance, even this television show, things don't just happen. You know, we got to work hard and make sure that this little guy's doing all right, you know? So every now and then you got to don your more sensitive side and pay attention to detail and make sure that your patient's doing all right. How you doing? Good.
We are at Pitt Bradford as our exploration of careers in healthcare continues with Mr. Alex Nasmets. He's the Director of Admissions. So what are the hot career fields right now in healthcare? And what are some of the hoops that people have to jump through in order to get a start in those careers in regards to education?
Okay. One of the hottest ones that's actually appearing on the horizon nowadays is nursing. Nursing is a great career opportunity for lots of people. All across the country, nurses are being cried for. There's lots of retirements going on, and as the nurses come through the system, their salaries are going up. There's lots of great pay available for nurses at this point in time.
This is a difficult career. Can be a difficult career. It's a lot of money wrapped up into the education. You are on not a fixed time schedule, generally, especially if you get out there into home health care, things like that.
When you're in the operating room, of course, with emergency cases, you have to take call time. There's always that time, you know, someone falls, breaks their hip, or, you know,
You're in there
you got an appendix or something.
We met an RN in your ICU unit, and we have an RN here in the operating room. Now, I would imagine pay scales are going to be different. I mean, is there a standard?
Pay scale is not.
It's not, really. Just the assignments are different? And
Yes.
Okay. And of course, the on-the-job training that you had to take.
Yeah. Well, I work ICU too, so.
Oh, okay.
I can do them both.
Okay.
But I mean, they're both actually specialty fields, so the pay scale would be comparable.
We triage the patients, we do their assessments.
You're on call? This isn't a 9 to 5. This ain't banker's hours.
I think in general you will find nurses to be very flexible. Nurses are very caring people. They're definitely the folks who put others in front of themselves, which they have to in order to take care of other folks who might be sick or in need of things like that. Time commitments. Time commitment is probably the biggest commitment. Outside of your own personal time, it's everybody else's time.
So as we found out, being an effective nurse is not all about the academic training, although that is a big part of it. So much of it comes down to who you are. You gotta have it in you. In here. Gotta know the medication, proper doses, all that. How to open child-proof bottles at times. All that kind of, there you go. Open up. There you go. Yeah, that's it. Good.
Get them ready for the doctor to see. We see anything from minor lacerations to cardiac.
Or you have to make sure all their surgical consents are signed. The doctors chart and do all their, you know, their history and physical, so you know what's going on with the patient. You know what kind of health problems, health risks.
Yeah, anything that doctor orders, medicines, lab work, EKGs, x-rays, everything comes up on our screen. We know what needs done and how our charting permits. As we do it, we can, the icon comes off and then the rest of the staff knows that the procedure of medicine has been done.
It's a physical commitment, it's a mental commitment, it's literally a spiritual commitment. Really is a whole being commitment outside of oneself.
Getting them ready for surgery, just preparing them for any tests that they may need.
You interview the patient, and you may have to give them post or pre-op antibiotics.
Yeah, it's really a life service. So you know, I mean, you may look at becoming a doctor for the money. But you're not going to be looking at becoming a nurse and going to the bank with it.
Right.
Respiratory, trauma, babies to adults, and once the doctor sees them, we're doing their IVs, their medications, EKG.
What are the fundamental differences for our viewers that might be interested in getting into nursing between an RN and an LPN?
RNs do more assessments. They can do more medications than the LPN.
The schooling is a big difference. I went 2 years part-time, where the RN has to go either 2 or 4 years.
Now you are a registered nurse.
I'm a registered nurse.
An operating room nurse.
Operating room and ICU.
Okay,
I
first.
have a little bit more responsibility, more kind of direct contact with the doctors than I do. I'm actually under them. I have to report to them on anything that I do. And that's usually the major difference. There's some procedures that I can't do or that I can assist with, but I have to have an RN there.
Tell us about what it took by way of education, your commitment. What kind of investment do you have in your career?
Well, to tell you the truth, it's you're educating yourself every day.
Yeah, but you had to have a basic fundamental. You had to have a basic.
You do have to have
foundation.
You have to have
be
a
an
basic.
RN.
Absolutely, and then as far as the human anatomy goes, the human physiology, the way the body works, then learning techniques. But most of that you learn that all hands-on, especially when you're out here in the field. And nursing school can only teach you so much, and they teach basically through the book.
Let's talk about the academic side of it.
Okay.
What sort of courses are you going to take when you come to Pitt Bradford or any institution of higher learning looking to get licensed in the nursing fields?
To be admitted into Pitt Bradford, into most nursing programs, students will have to have a heavy science background, biology, strong chemistry. Mathematics is also part of it. English skills are very important. Writing skills are very important. We're going to be looking at those types of things for any student coming in on an entry-level situation, coming into a program such as this. Standardized test scores help us with regard to where a student might be in the future, or how they might predict in the future, I should say, with regard to success rates. Once in college, students are going to take things like anatomy and physiology. They're going to take kinetics. They're going to take chemistry. Courses that are not your run-of-the-mill, everyday cake college courses. That's why student nurses are probably one of the most committed students on a college campus. They don't necessarily have an awful lot of free time for themselves. Their free time consists of internships at the hospital or internships at the nursing homes. Lots of different things where their free time in college becomes part of what they do and what they are expecting to do down the road. So academically, they're probably a much stronger student than a lot.
I started at Lock Haven. I'll be starting my second year in September. I love it. This is like an optional class for us through Lock Haven. You can pick how many credits you want. I'm doing 1 credit, which is 45 hours in whatever department. You get to choose which department you would like to be in.
But when you're out here, it's all hands-on. This is stuff that you have to pick up on your own. And so, I mean, like I said, every day you're learning some new technique. You work with different doctors, and different doctors always have their own way of doing things. So
this is a rotation that she does not get in school, and this is one of the reasons why she's down here, because it gives her a sight of what critical care nursing is.
As an adult student coming back to school, requirements are a little bit different.
Yeah.
We might actually look to put you into a program, what we consider a pre-nursing program, which is a program that allows a student to spend 1 year in the nursing curriculum, taking courses that they're going to need to take in order to prepare themselves to get into the nursing curriculum. And that's a great way to actually see how those students might predict out. Some students realize at that point that they're not going to be able to make it if they can't take the pre-nursing program. They're not going to make the nursing curriculum that they have laid out in front of them. It's a good way to kind of shake the tree, if you will, to see who's going to survive and who won't survive. But as an adult student, we won't be looking at high school background as much.
Well, Corey, we found out there are a lot of myths associated with this profession.
Well, there's myths in them with everything.
As it is, that's true. For instance, you gotta be a woman to be a nurse.
That ain't a myth. That's a sexist comment. You're sexist.
Dude,
you just made a sexist comment.
I said, Corey, if you were listening, that's my point. That is a myth. It's not true.
All right. See, I can be a nurse too. I'm a dude.
What do you Nurse Betty from 1940? What's this?
All right, now you're being stereotyped. Now you went from sexist to being stereotyped.
Okay, Tom, you have a question?
Yeah, there's something I've been wondering about nurses for a long time. Nurses have been known to be very, how should I say, attractive. The usual picture whenever someone thinks of a nurse is a busty blonde woman wearing a cap and carrying a syringe. Would you say there's an accurate image of the naughty nurse? I mean, registered nurse. And will we be receiving?
Tom, I think they call this ambush journalism.
It's definitely ambush.
Would you say that there are any particular myths in regards to your career field?
Probably the biggest myth would be that it's generally, the public views it as a career for females, and there have been more and more men entering the field. And
when they see a male nurse, they actually perceive you as a doctor, which is very
automatically. They're going to think, isn't that something?
So then you submission over, and then you're just telling them, no, I'm your nurse, and they're like, oh, really? And but even when you're out, friends, peers, everybody, they're just, they make fun of you, but it's something that you just take with a grain of salt.
I actually work both the floor and ICU, and I worked the floor for a good year before I was allowed to come out here. Basically, it's experience. They want someone that knows the basics before you ever come out into like a specialty field. And then you get training on the job. I mean, you can't really train nursing in the school or outside of the hospital, because that's where you learn.
Now, what made you get into this as a field? It is not a typical field for a male to jump into.
No.
It's growing, though.
Very much so.
Well, what was it that factored into your decision?
In fact, both my grandmothers were both nurses. Actually, this was my second kind of career. It was a career change for me. I worked mental health, and then just wasn't very happy. Wasn't really getting like the feedback from my clients at the time. And nursing is just so much more rewarding.
Tell us why.
The fact that you can help somebody, you make somebody laugh, you make their day, you make them feel better. Just being there for them, it's very warming.
I don't know. He's not breathing. I don't hear anything. I don't know what Corey, you want to be the nurse? What do I do?
I don't know. I didn't get it.
God, is this thing working? Ow!
You're getting that instant gratification.
Absolutely.
Somebody's shaken up, they're nervous, you put them at ease, you can walk away saying,
yes.
Yeah, I did something cool.
Even after a hard day, it's nice.
Wake up! Like, get up! No, he's not responding! I don't know what to do! Get up!
In the admissions process, do you ever find yourself saying to somebody, Sam, I've spent a few minutes with you, and just don't think you're cut out to be a nurse. Yeah, would you be upfront with me and tell me that?
I would, actually.
We're at Charles Cole Memorial Hospital with Amy and with Bonnie, and we are discussing careers in home health. And we're going to be shown some of the most advanced technologies being used in rural home health today by home health care professionals. So Amy, Bonnie, get us started with, first off, defining what a home health care professional is in rural central Pennsylvania.
As a director of home care and hospice, we really look at the care of the patient that's provided in the home. And that could include such things as wound care, new diabetics, those types of things. But we also now really look at care after hospitalization and try to prevent patients from being hospitalized.
It's a growing trend now. People aren't allowed to stay in the hospital as often, mostly due to insurance reasons. So we have a lot sicker people being sent home.
My clients, I have male, female. They all range from giving them bath to assisting them, watching them so they don't fall. And I do shopping for some, housekeeping for some, we bake for some.
What I have noticed with a lot of our patients is they get discharged from the hospital with congestive heart failure or a lot of breathing problems, which is called COPD. With our new monitor system, the telemonitoring system, we can actually record daily weights, blood pressures, pulse oximeters, and heart rate.
What would you say is the most challenging aspect of your job?
You have to work alone. You know, you go into somebody's home, you're the only nurse there, so you need to be confident in your assessment skills, your clinical skills, because there's not another nurse sitting out here at the desk so you can say, hey, come look at this or come do this for me.
Do you have to be a registered nurse? Do you have to be an LPN? What do you need to get the ball rolling and to enter into this career field?
Well, RNs are used financially because of RNs do assessments, admission assessments, discharges. The LPNs are used greatly in assessing a patient doing wound care. Mm-hmm. So there's different qualifications that we need for specific patients.
Aides can also work in home care as well as anyone from rehab. That would be physical therapy, occupational therapy, speech therapy. We have a social worker, and of course the bulk of our it is RNs and LPNs, but we also have aides to do the personal care out there. So it's really interdisciplinary care that we provide out in the home.
To rest this arm, and when she tells you, you're going to push the green start key.
Press the green start BP key.
Okay.
Push that green button.
All right. I'm pumping up here. Now, as we know, I just spent 2.5 hours in the car with 4 teenagers, so I'm a little aggravated right now. We're going to find out.
Don't blame it on us.
We're going to find out what my stress level is.
We have the scales also that I can hook up for people to check their weight every day.
We don't want to do that.
And
do you want some more?
Not too much.
Just a little bit more?
So, how long have you been in home health?
Roughly 2 years. Plus, I'm a nursing student too, so I like home health. I like taking care of the patients, clients, and helping them. And it's nice to let them be at home. That's what
I'm so used to cooking that I don't know what to make.
She used to cook for a big family. How many children? 9? 9 children. Home health is wonderful. Excuse me. Hello, Maurice. We help you.
First time I was sick different times, but this is the first time they ever came and helped me out like this. And I appreciate that very much.
And that you're not...
She is very good.
Well, thank you. I didn't pay her to say that either.
Now, Bonnie, you were telling us you also utilize smaller computers, such as this little mini laptop.
Now, what do you utilize this system for?
Actually, Charles Cole Home Health has used laptops and a computer system. It's a point of care that's used right out in the patient's home, and this happens to be Amy's laptop. Every one of our nurses has a laptop where they actually do not do anything on paper. They put all the information for the patient in the laptop. So we're very fortunate here to have the availability of the technical laptops.
Well, so this definitely made your life easier.
And also, with this laptop, I also have the program, so if I am in Port Allegheny, or I'm home for the day, or, you know, we have different people to cover the telehealth, I can also hook this into the phone and check my monitor from this computer.
Let me help you?
Now, you say home health you really enjoy.
Yes, I
What is
do.
it about it that you like so much?
I like the fact that we can help with the patient, the client, be in their home and stay in their home until the end. That they can stay in their own environment, that she doesn't have to leave here and go to a nursing home. That's the one positive thing that they like to do.
2 weeks.
2 weeks.
You also have to prioritize what patients need seen, what time, how soon during the day. Sometimes you're given a load of 8 or 9 patients, and you need to decide who can be moved till tomorrow, who needs to be seen today.
I mean, it's a wonderful career. You get to help patients.
Well, obviously, there's also some cooking involved
There's
too,
some
so maybe some
cooking.
culinary.
Yes.
350.
350.
Thank you, Justin.
We need younger nurses, and we need all types of nurses to help in home health. Home health is an area that will just really explode with the technology out there, as more patients will be cared for in their homes versus come into the hospital base.
Coming directly out of college with a 2-year associate's degree, students could probably, as an RN, a licensed RN, students can probably be looking at a high 20s, low 30s starting salary. With a bachelor's program, you're going to be looking at a solid 30s. With a master's level, you're going to go up from there. It really depends on the location and where folks are going. It's a demanding field, so the pay is pretty decent to begin with. Students coming in to the program as a freshman, the investment is steep. It definitely is steep. And folks who are changing careers, it's a life-changing investment, actually. Once you've already established a career, been in a career and decided to change it or go in a different direction, there's lots of different investments, especially time and money.
You're supposed to be the pro. You don't hit it. You don't hit it. I didn't even go to school, and I know not to hit it.
It was a bad example.
You're sick.
I lost myself.
Don't make excuses.
How's
Don't
the
make
little guy
excuses.
doing? How's the little guy doing?
Oh, like you care.
Wow, that hurts, Corey. That hurts, man. That hurts right here.
You're sick.
I mean, I know I don't
You
have
need
what
help.
it means to be a nurse.
You need help. You need help. You're supposed to be the professional.
Your advice to someone looking at either a career change or entering into this careers in healthcare, what would you quickly advise them to, as far as making the right decision and forming themselves?
Speak to people who are in the career, who are currently nurses.
Myself, I've started out in home care as a nurse 30 years ago, and it's still exciting to me today.
Explore the resources that are available right in our communities. Speak to professionals, nursing professors.
I definitely say explore all your options. Know what you're doing before you actually get into it.
Speak to your family and make sure they are willing to support you and the time commitment necessary.
I'm sorry. You're watching Futures. Fast forward.
It's all right. It's all right, man. It's all right. Don't worry. We'll get through it. We'll get through it. All right.
Shane, maybe actually have a career in home health after all.
And home health, no. I want to be a chef. Wow, that's all.
You boys like the ends or the middles?
It don't matter.
Ooh, I like the middle. I like the middle.
You know?
Sam, smell it. It smells so good.
That's funny.
You're picking one.
You know what's really funny?
What?
Look at the size of the dent in that.
Got a big nose.
That's an Italian dent, buddy.
I'm sorry, Sam.
Couldn't pass that up, could you, Shane?
No, I just couldn't.
Oh, never made before.
Usually, people are like dying to get rid of us, but here, you know, fringe benefit.
That was fun. I do have to give it to you. That was a good one. That was a good one, Shane. You're a laugh riot.
Can't eat them with your fingers. I can.
Oh, yeah.